Hi everyone, and thanks for joining us today. My name is Joseph Jackson, and today we're going to review some important information for our new providers. First, a little bit about Employee and Family Resources. EFR has been around for over 50 years. We were established in 1964 as a not-for-profit health service organization providing independent assessment and referral services. Our EAP started in 1975, and we established our new provider network in 1986 to service our EAP clients all across the United States. EAP services are provided to employees of companies as well as dependents and members of their household that contract with us for the EAP benefit. The program is designed to identify and assist employees with problems that interfere with work productivity or cause difficulties that might impact their home or work life. EAP services include assessment and referral, short-term problem solving, referral resource identification, education, and work-life services. Using the EAP is voluntary and confidential and at no cost to the employee. EAP services are there to help employees and their families cope with and resolve life's problems, but the distinction of the EAP program is its workplace focus. Now I'd like to introduce some members of our workplace services team that get very involved with our network providers. First, we have Kathleen Cody, our operations director, Lindsay Langer, one of our phone counselors, Tracy Jensen, our provider relations specialist, and Verna Rice, our operations specialist. Let's have Kathleen get us started with a little bit more about our EAP services. Kathleen?
Thanks, Joseph. Hi, everyone, and thanks for joining us today. EFR has a strong commitment to accessibility to our EAP services and non-discriminatory practices. No one should be denied services, and we want providers to ensure that their facilities are accessible to everyone. Other important services provided through EFR's EAP that we haven't mentioned yet are crisis response and Federal Department of Transportation substance abuse professional evaluations, which comply with federal guidelines. First, a bit about our on-site crisis response. Our crisis response services typically consist of sending a counselor for our on-site services at the company location for a 1-hour group debriefing session, and then staying a short time afterwards for anyone that wants one-on-one time with the counselor. The goal is to help employees process their reactions and emotions to the crisis event and move toward resuming normal productivity in the workplace. Common examples of on-site services include grief sessions following the death of an employee, or a debriefing after a bank robbery or some other traumatic event. The Department of Transportation cases involve a violation of the federal regulations, such as a drug testing violation or other violations under one of the federal operating administrations. These are typically employees with a commercial driver's license, but could also be somebody that performs other types of safety-sensitive duties and is covered by the federal rules. There's a very specific process that the employee must go through to satisfy federal requirements that involve an assessment and referral by a qualified substance abuse provider.
Thanks, Kathleen. Now we have Lindsay Langer, one of our phone center counselors that works with our providers on a regular basis, to explain some important clinical distinctions of EAP counseling work.
Thank you, Joseph. Our expectations of our providers is that you will listen to and assess the concerns presented to you, help the individual formulate a plan for resolution, assist in finding solutions, and facilitate any necessary referrals to available resources within your community. The referrals may be for support groups, community agencies or resources, or a behavioral health professional for further counseling beyond the EAP. It's also possible that a referral back to EFR for legal, financial, elder care, or other work-life issues may be necessary or helpful. We will provide consultation to the client through their benefit with the EAP.
Lindsay, tell us a little bit about the EAP assessment itself.
The EAP assessment needs to include family, marital, health, mental health, substance abuse, financial, legal, dependent care, and workplace issues. We sometimes have clinicians tell us that they don't do substance abuse treatment, and we want to emphasize that we're not expecting you to do treatment. we need each client to be screened for substance use as part of the overall assessment. If your assessment reveals that a client needs treatment, then you would make a referral for the treatment phase. We also emphasize a focus on safety screening to identify severe depression or suicidal ideation. And lastly, we don't want you to lose sight of the fact that the workplace is a central focus. Even if the issues they are presenting are personal, those issues potentially have an impact on their work performance. When making a referral for further counseling, you may self-refer as long as you are providing at least 2 other appropriate options in your community. At that point, the employee would be paying for your services through their insurance or out of pocket. The expectation here is that you will be helping to facilitate the referral by getting insurance information from the client, to provide a provider that accepts their insurance, facilitate as needed based on the client need and capacity, and to give support and follow-up with the client to ensure their connection with the provider.
Lindsay, how do clinicians work differently with EAP clients versus their private practice clients?
Great question, Joseph. The main difference between an EAP client and your therapy clients is that you are making a connection with the client that is sufficient to complete an assessment, but not one that necessarily leads to an extended relationship. At times, the presenting and assessed concerns can be handled within the number of available EAP sessions because you have provided them with enough feedback and guidance to allow them to work towards improving their situation on their own. Our company's contracts typically include either 3 or 6 hours. Also, the EAP contract adds an element of neutrality. Since the client's employer contracts with EFR for the EAP services, we have a requirement to remain neutral on any issues between the employee and employer. That would include topics like workers' comp claims, short-term disability, time away from work, FMLA, or other company policy concerns. It is appropriate to acknowledge feelings around these issues and offer support to address related stress, but advocating on behalf of the employee is not appropriate.
Tell us about employees that are referred to us by their manager or human resources department.
Employees are sometimes referred to us by their manager or HR representative for performance-based issues in the workplace, and we call this a management referral, which is sometimes referred to as a work performance referral. The goal is to work towards improving the workplace issue. These cases involve a release to allow EFR to speak directly to the employer about the employee's progress and commitment to improving performance. You will not be discussing the case directly with the employer, but with the EFR case manager. We have a guide that will be sent with instructions specific to these cases should we ask you to work with this type of client.
Wonderful. Thank you, Lindsay, for that helpful information on the clinical side. Let's turn it over to Tracy to talk a little bit about our referral process and paperwork.
Thanks, Joseph. Our new providers may have noticed we have a guide for our paperwork that is included in the provider manual sent during the credentialing process. We send case paperwork with the authorization for each client. We will give a verbal authorization over the phone, followed by an authorization form that we will fax or send via secure email. The authorization includes the client name, the number of hours of service authorized, and an expiration date. The hope is that you will complete your assessment in a timely manner, and the authorization period allows for that. Part of the paperwork that accompanies the authorization is an assessment form, but you are welcome to use your assessment form that you use in your regular practice as long as it covers everything that ours does. The paperwork guide in the provider manual describes how the forms should be used. If you have questions about the paperwork, reimbursement, or want to speak to one of our counselors, please call or email us for help. Several phone numbers and email addresses are on the last page of your provider manual. Please feel free to call or email us with notification of any temporary inactivation due to time away from the office or to alert us that paperwork may be delayed.
That's great. Thanks, Tracy. Verna, give us a few more details about case paperwork and some of those issues that you see creep up fairly often that might be helpful to our new providers.
Yes, remember that paperwork given to the client should be EFR paperwork, including any releases and the Statement of Understanding, which is our part of the EAP case data form. Since the EAP clients are ours, not yours, it's important that you're using our versions of these forms for them to sign. It's perfectly acceptable to ask them to fill out your intake form for some demographic information or symptoms checklist. There are 2 forms that are commonly overlooked. The first is the EAP case data form. This is designed to have the client complete, read, and sign by each client being seen at the initial appointment and then sent back to EFR immediately. The second form is our client QA survey. The client fills this out at the last session and it should be returned with the final case paperwork. You can submit billing for each session individually if you like, and you have 90 days following the date of each session to submit billing paperwork. It's not 90 days after the last session. It's 90 days after each session. In most cases, you should be able to return the paperwork for all sessions together and still be within the 90-day window.
Thanks, Verna. For any of you that would like more information on employee assistance programs, visit the EAPA website at eapassn.org. This organization focuses on the role of the provider. We hope you found this webinar helpful, and if you have any questions, please feel free to give us a call or send us an email. Thank you for listening.